Hello, I'm Georgie and I've been at Smilecare for 2.5 years. I'm really enjoying working here. It's a great place to work. Everyone looks after you really well. You're our advert for the practice, so we want you to be really pleased with what we've done. Go out and tell your friends about us and come in and see us so we can look after you. I started as a dentist. I qualified in 2004. I trained at St Bartholomew's in the Royal London Dental School. I then spent 4 years in the hospital, 2 doing oral surgery and dental A&E, and then 2 years in restorative dentistry at the Eastman Dental Institute. That led to a master's in conservative dentistry, which has led to my interest in fixed prosthodontics and implants. Okay, implants are a brilliant way to replace a missing tooth. They can really change your life because they replace a missing tooth without touching a tooth either side. You're able to eat, smile, they look like teeth again. It's like getting a new tooth. Really, to tell you a little bit about what a dental implant is, the implant itself is a titanium screw which goes into the underneath the gum, into the bone, and then a crown, just like a cap on a normal tooth, sits on top and is screwed on top, so it can look and feel like a tooth, and you can use it to chew with, so it looks good and it'll feel nice in your mouth. How we go about making them is, once the implant's in, we then take impressions of your upper and lower teeth so that we can get an implant crown which is going to fit in with your natural bite and feel comfortable to chew with. Implants, start to finish, usually take within 4 to 6 months to place. There's quite a few appointments, so we do get to know you pretty well, but that's because it's so important to get it right for you and to make sure that you're going to be pleased with the final result. Yeah, a lot of people are worried about having dental implants, but you really needn't be, because it's just a little bit of vibration putting the implant in and you're awake completely through having that done, and we can talk to you. I do find my patients are really pleased that they've taken the step and had a dental implant, because it's fixed, so it's screwed, the crown is screwed onto the implant, so you can floss and clean around it. In fact, it's important to clean them and look after them just like it was your tooth, and people start to feel it is their tooth, that it's you, and you can chew with it and treat it like a normal tooth. I'm a bit of a perfectionist, so I'm only happy if you're happy, and I want you to feel that the implant looks and feels like a tooth and feels right in your mouth. That means I'll spend a lot of time talking to you, finding out what you want, getting it right for you, and also speaking to our laboratory technicians to make sure we get it just right. The benefits of having implants here is that we can look after you from start to finish. We're always around, and I'm around if you need to ask any questions, but also our hygienists here are trained in looking after implants, and they have all the equipment to clean around them, help show you, which I'll also do, how to clean them and look after them, because the most important thing is longevity and making sure you know the prevention side as well, to look after your teeth and gums and keep them healthy, but also so that you'll feel pleased with them, and you can be our advert to show people and hopefully send your friends our way as well.